Hello, the students. Today we will talk about biopsy. It's very important tools for diagnostics, for precise diagnostic, and biopsy. It's golden standard of the diagnostic. We know it's medicine, not so precise branch of science like math or physics or probably some engineering, but we also try and make some clarification in diagnostic process. Biopsy, it is something what we have touched and thoroughly investigate, and it is increase our chances to build some right diagnosis and make some successful treatment in many patients. Okay, what is this biopsy? Biopsy introduced by Ernest Besnier, is French dermatologist, which introduced biopsy as to medical community at 1879. Biopsy consists from two Greek words. It's bios, it's life, and opsis, it's a side. It means you can see it's very clear by own eyes. Shortly, it's in vivo removal of tissues, piece of tissues for microscopic examination and determine nature of the disease. This objective method of diagnostic consists from its most reliable method. For providing this method, we should take some cells and tissues, and this methodic allows us to determine exact cellular and tissue composition of test material. This is allow us make diagnostic of cancer, inflammatory process, and the non-inflammatory process. Biopsy often assisted by radiological method, endoscopic, and immunological methods. This makes this diagnostic more precise if we apply such method together. The most important role of biopsy we can see in surgery, because in process of surgery we need to specify volume of operation. It depends of histology, and if in case of some malignant process, we should expand volume of operation, and it's or decrease this amount of tissues for extirpation, etc. Biopsies have several types. An example I explain about excisional biopsy. It's a type of biopsy which allows us eradicate whole lesion or mass and remove this mass for testing. It's a very good decision in case of some suspicious pathology on skin, and we make this procedure for avoid of spreading metastasis, etc. and take whole tissue and organ. From another hand, is incisional biopsy. It's medical test in which for removing piece tissue or parts of the lesion mass. And on this picture, we can see difference between incisional and excisional biopsy. Incisional, we take part and later decide what we should do with this lesion. Return to surgery or leave it as is. Next type of biopsy is puncture biopsy. For this type of biopsy, we use special instrument like pencil eraser, and usually we doctors use some instrument like needle. It's allow us remove some circular volume of tissues, and later we take this tissue for testing and microscopic investigation. It's there are several types of puncture biopsy. It is fine needle aspiration puncture biopsy. We use syringe is for removing liquid tissues, some individual cells for obtained aspirate, and further examination by microscopy. Next type biopsy, it's punch biopsy. It's usually this method used in dermatology. It is biopsy of skin tumors, of skin disease, and for such biopsy we use special needle. It's big diameter. Trephine biopsy, it's very similar to punch biopsy, but this type biopsy used for solid and hard tissues, and it's often used in solid tumors and in bone marrow, and it's in this case we use special type of needle. Okay, it's the different type of biopsy. It's liver biopsy. Liver biopsy used under control of ultrasound, more rarely computer tomography, or without any control. In Sumy region, we have such activity before about 4 or 5 years ago, but now we have some precise biochemical test and fibroscan procedure. It's allow avoid of some invasion method such liver biopsy. Because it's painful procedure, and in some cases leads to complication like pneumothorax or bleeding from liver. Next widely spread procedure is biopsy of breast tumor. It's type of trephine biopsy. Often used in oncological hospital before surgical treatment. We take this tissue and provide immunohistochemical study for we find estrogen, progesterone, and head-to-new status of breast tumor. According to this result, it's patients receive adjuvant, neoadjuvant therapy. Okay, it's very important in a modern protocol of treatment such patients. More difficult type of biopsy, it's biopsy of kidney. For such type of biopsy, this biopsy often need ultrasound control because it's so difficult obtain kidney tissue. It's by some anatomical circumstances. Now, this is punch biopsy for skin pathology. It's special needle for punch biopsy. Next type biopsy is endoscopical hysteroscopy, used for obtain a biopsy of cervix, cervical pathology, tumors, and pipal biopsy used for endometrium polyps or some endometrium hyperplasia. In the diagnostical process of infertility also, this procedure will take piece of endometrium and check hormonal status. It's very important in treatment. Okay. In general, all type of biopsy divided on histological and cytological type. It's histological type are pinch biopsy. For pinch biopsy, usually material was taken using special forceps for pinch biopsy. Trepan biopsy used for dense and solid tissues, and this biopsy provided with hollow tube. It's a very acute pointed edge, and usually it's appropriate for bone biopsy and dense tumor. Core biopsy used for soft tissue. Also, this type of tissue taken by special device, and most of biopsy provided under local anesthesia. Probably some type of biopsy provided under general anesthesia. Next type is surface biopsy or scarification. And, this type biopsy used in dermatology practice, and it's used this biopsy for pathologist information, and mechanism, it's cutting of thin layer of tissue from surface of skin or tumor. Next type, loop biopsy. Usually such type of biopsy, used in endoscopic practice, and in applying together with coagulator for prevent bleeding from this place, which used for like focus for biopsy. Also used in gynecology and gastrointestinal pathology. And next type biopsy is incisional and excisional biopsy. And I repeat, the incisional biopsy is removing of part of pathological tissue during surgery. Excisional, it's removal entire organ or entire whole pathological formation during surgery. Cytological type of biopsy, it's puncture. We take, often it's using for taking liquid from abdominal or pleural cavity. As aspiration and some internal parenchymatous organ like kidney or liver or thyroid gland. Aspiration biopsy, it's for aspiration biopsy, usually it's using of syringe for suction of content from cavity or organ or cyst. Impression from pathological formation used in also in dermatology practice. It's in this situation, material directly transferred on glass slide to apply to affected surface. Smear-imprint from pathological formation. This used in gynecology and dermatology. This for such type of biopsy using special instrument like spatula, scalpel, or special brush. It was general information about biopsies. Thank you for attention.